Patients come in asking why their teeth are sensitive, why their gums bleed when they floss, why they keep getting cavities despite brushing twice a day. You might be damaging your teeth right now without even knowing it. And I'm not just talking about forgetting to brush. There are habits most of us do every single day that slowly wear down our teeth. Today, I'm going to walk you through the most common ones I see in the practice, and more importantly, what you can actually do about them. I'm Momin, and I've been working as a dentist for years. In that time, I've noticed the same pattern over and over. Usually, it comes down to a few habits that seem harmless but add up over time. Let me explain what's really going on. Let's start with drinks. Soda, juice, energy drinks, even things like lemon water, all of these contain either sugar or acid, and both are problems for your teeth. Here's why. When you consume sugar, the bacteria in your mouth feed on it and produce acid as a byproduct. That acid eats away at your enamel, which is the protective outer layer of your teeth. Now, even if you are drinking sugar-free beverages, many of them are still highly acidic. And if you are sipping on these drinks throughout the day, your teeth are constantly under attack. It's actually worse to sip slowly over an hour than to drink it the same amount all at once. So what can you do? After drinking something acidic or sugary, rinse your mouth with water. Try not to sip. Drink slowly throughout the day, and if possible, use a straw to minimize contact with your teeth. Another thing I see all the time is people brushing way too hard. They think scrubbing harder will clean better, but it actually does the opposite. Brushing too hard wears down your enamel and can cause your gums to recede, which lead to sensitivity and other problems down the line. There's also a timing issue. If you eat something acidic like citrus or vinegar-based food, that acid temporarily softens your enamel. If you brush immediately afterward, you're essentially scrubbing away softened enamel. It's better to wait about 30 minutes before brushing, or at least rinse with water first. Use a soft bristle toothbrush. Apply gentle circular motion. You don't need to press hard. Let the bristles do the work. Let's talk about flossing. I know it's not the most exciting topic, but it matters. Your toothbrush can't reach the spaces between your teeth. Those tight spots are where plaque build up, and that's where cavities and gum disease begin. A lot of people ask me if flossing is really necessary. The answer is yes. Once a day is enough, but you need to do it. If your gums bleed when you floss, that's usually a sign of inflammation, not that you're doing something wrong. It should improve with consistent flossing. If traditional floss is difficult for you, try floss picks or a water flosser. They work just as well. The key is to clean between your teeth every day. This one might sound obvious, but I see it more often than you think. Using your teeth to open packages, chew on ice, bite your nails. All of these put stress on your teeth that they are not designed for. Teeth are strong, but they are not indestructible. Chewing ice, in particular, can cause tiny cracks in your enamel. You might not feel anything right away, but those cracks can grow over time and eventually lead to bigger problems like fractures. That's when you're looking at crowns or even root canals. The fix is simple. Stop using your teeth as tools. Keep scissors or bottle openers handy. If you chew ice out of habit, try switching to chewing gum instead. Grinding your teeth, especially at night, is another big one. A lot of people don't even realize they are doing it because it happens while they are asleep. Over time, grinding wears down your enamel and can flatten your teeth. Common signs include waking up with jaw pain, frequent headaches, or increased tooth sensitivity. If any of that sound is familiar, you might be grinding. The best solution is a custom night guard from your dentist. It acts as a cushion between your upper and lower teeth. Managing stress can also help, since grinding is often linked to tension. But even if you can't eliminate stress completely, a night guard will protect your teeth. Smoking and vaping both have serious effects on your oral health. They dry out your mouth, and a dry mouth means less saliva. Saliva is important because it helps neutralize acids and wash away food particles. If you eat without enough of it, bacteria thrive, which increases your risk of cavities and gum disease. I hear a lot of people say that vaping is safer than smoking, but when it comes to your teeth and gums, it's not safe at all. It still dries out your mouth and damages your gum tissue. If you smoke or vape, the best thing you can do is quit or at least cut back. Your mouth has an incredible ability to heal once you stop. Even small reductions can make a difference. The last habit is one I want to emphasize: skipping a regular dental visit. A lot of people think that if their teeth don't hurt, everything must be fine, but cavities and gum disease often develop without any symptoms in the early stages. By the time you feel pain, the problem has usually progressed to the point where treatment is more extensive and more expensive. Regular checkups allow us to catch issues early when they're much easier to fix. Even if you take perfect care of your teeth at home, professional cleaning remove buildup that brushing and flossing can't reach. I recommend seeing your dentist every 6 months or more often if you have specific concerns. These habits might seem small, but they add up over time. The good news is that most of them are easy to change once you are aware of them. If you found this helpful, I'd appreciate it if you subscribe to the channel. I'll be sharing more straightforward dental advice that you can actually use. Thanks for watching and take care of your teeth.